Hi, I wanted to take the opportunity and introduce myself. My name is Dr. Eryn Milian, and I am one of the co-founders and instructors for the dissection course that is coming up this May. And I wanted to just take the opportunity to let you know a little bit about myself and then tell you a little bit about what you should expect for the course. I work as a full-time professor at the University of Miami. I completed my PhD here after I got my DPT in physical therapy, and my PhD focus was in anatomical sciences. So in 2015, I took on a full academic role here as an assistant professor and have been teaching the Gross Anatomy curriculum here at the University of Miami with the DPT students over the last 10 almost years. And then more recently, in the last couple of years, I have taken over a role that involves the medical students as well. So I help with their gross anatomy curriculum, doing some of the dissections, prosections, and teaching within the medical school here as well. And Kyle and I met, and we're both students here at UM. And then more recently, we have been discussing and formalizing this course for you guys because we felt there was a need and a desire. So this is a passion project for us, and we love teaching it every year and love getting groups together to explore anatomy and learn from, in my opinion, the best way that we can learn, which is these donors. So we have a 5-day course where really you get to see the entire body and get to explore and make clinical connections and do all these things that will hopefully inform your practice and your patients. That's the ultimate goal. So a little bit about what you can expect in this 5-day course is an exhaustive review of gross anatomy. On the first day, we usually start with our donors prone, face down. We get to explore more the musculoskeletal system, the back, the limbs, and talk about the neurovascular structures. And then as the course progresses, we get into some additional areas. We get to explore the thoracic cavity, the heart and lungs in detail. We open up the abdominal cavity and get to explore the entire digestive tract and the relationships to other areas. And then we get more into the neuro and spend some time on the autonomic nervous system, exploring kind of the posterior thorax and posterior abdominal wall and where a lot of those structures are. And then on the last 2 days, we get to focus more on kind of brain, spinal cord, do those dissections, remove the brain and see the cranial nerves. And that's a nice link into what our other curriculum and kind of an add-on to this 5-day is the CNS dissection component and course, which involves a little more in-class detail and lecturing, as well as the specific brain sections and learning in detail about the neuroanatomy. So if any of that is of interest to you, then please check us out, and you can also reach out and ask us questions via the website and email. So I look forward to hearing from you.